Many patients don't know what options they have for tooth replacement. You have two options really. One category is removable options of tooth replacement, and one category is fixed options of tooth replacement. If we start with removable, you may have some teeth that are missing. This is what we call a removable partial denture. This patient is missing some teeth and have some teeth remaining. The partial denture has a plastic saddle that fits over the ridge of bone. It has a couple of wires that hook around the natural bulges of the teeth. And when that partial denture goes in the mouth, when the patient places that in the mouth, those wires bend out and back in to hold on to those teeth. And that's what retains that partial denture in the mouth and keeps it there. There's pluses and minuses to this. The big plus is that it doesn't matter how many teeth you're replacing in this arch. It basically is the same fee. So it can become a better value because you're replacing a lot of teeth at basically the same cost. So it doesn't matter if you're replacing one tooth, 3 teeth, 8 teeth, it's the same fee. We go through all the exact same process to fabricate this partial denture. The negative of the partial denture is the fact that it does wrap around the other side of the mouth. So if you were replacing teeth on one side, it does have to wrap to the other side of the mouth. And that does take up some space when you do that. Anytime you take up some space in the mouth, it takes some getting used to. What's great is we can make a partial denture out of materials that are very strong. So this is chrome cobalt, and a portion of this partial denture is very thin here, very small, but yet I cannot bend that. If I put as much force as I can on that, it's extremely strong. So we can thin it down very small, so it's not as obtrusive in the mouth. Another negative of the partial denture is that the plastic saddle portion of this is not adhered to the tissue, it's just resting on it. So you can get something very small underneath there. Let's say a strawberry seed can get under there, and if you're chewing on that, you're probably going to know it. You'll have to stop, take that partial out, rinse your mouth, rinse the partial off, place it back in, and go from there. Another option for tooth replacement would be in a fully edentulous situation where you don't have teeth remaining. This is a traditional full denture. Again, it's got pluses and minuses to it. The biggest plus of full dentures is the fact that we can do whatever we want aesthetically. We can change the color of the teeth, the shape, the size, the position, all of those things. And that's the biggest benefit of full dentures. Again, positives and negatives with full dentures. There's a huge difference between upper denture, traditional denture, and a lower traditional denture. The upper denture does come back and cover the roof of the mouth. It has to, because the way that this stays in is with suction. So it's pushed to place, the air comes out from underneath, and that's what holds that up in there. How much suction can there be really relies on how much ridge is there in an individual basis with each patient. How high the roof of the mouth is, the palate, is a factor also. Whether or not you have a dry mouth can be a situation with a full denture and it wanting to stay in. because a moist suction cup always sticks better than what a dry one does. And so that moisture is significant with the denture. The lower denture is much different. It doesn't have any suction and can't really get a lot of it. The reason being that the shape of the lower ridge is a horseshoe shape, and the tongue is down here moving around at all times, and that traditional denture just rests on that ridge. And I have patients say all the time, well, maybe I'll just use some adhesive to hold that. And the reality of it is, it won't hold it. It wears out quickly, and it does not hold that denture down well. So any patient that I have ever asked who wears full dentures, and I would have you ask anyone you may know also, of your dentures, your upper one and your lower one, which one do you like better? And it will always be, I'll guarantee, the upper denture. And that's because it does have something helping to hold it, the suction, in place while you're chewing. The other thing I have patients ask me a lot about, as far as traditional full dentures like this, is once I have them made, is there anything else I need to do with them over time? And the answer is yes. Normally what will happen is, without any teeth in the mouth, you do lose a little bit of bone over time, a little bit of resorption. It's a very slow process, but we do recommend relining these dentures on the inside to get them back up against the tissue snugly for the best fit, usually about once every 2 to 5 years. The change in the mouth, as far as the resorption of the bone, is extremely slow, so you usually can't tell very well that things have changed that much within the 2 to 5 years. It's very subtle, and most people compensate for that. You may start using adhesive when you didn't use it before, to help hold your dentures in better. So keep that in mind, that yes, there is some maintenance with those. The other thing we like to do is clean these dentures for you. I have patients that think, well, I have full dentures, I don't have any teeth, I don't need to see the dentist. But that's not really true. We do like to check all of your soft tissues. We like to check for sore spots that may develop from the dentures. We like to do cancer screening. We just like to make sure that that tissue is all healthy in the mouth. We also like to clean these very well, polish them for you in our lab. Keeps them nice and smooth and comfortable. Cleaning these at home, I have patients ask me all the time, how do I clean these at home? What should I do? I see on TV I shouldn't use a toothbrush. I don't find that to be true. I think that when you get a new set of dentures, if you start right away using a toothbrush with a little toothpaste on it and cleaning that inside and outside real well, just rinsing it with cool water, that usually will keep it very, very clean if you do that from the start. It can create some little micro scratches on the surface of the denture, but again, if you're coming in, I'm polishing all that out and keeping that nice and smooth for you anyway. My concern would be that you do keep it clean, and using that toothbrush with a little paste on it, I think, is fine. Another removable option for tooth replacement would be a full denture that's stabilized with implants. So this is an upper full denture, much like we just looked at with the traditional denture, except the main difference with this is that the roof of the mouth is cut out. With a traditional denture, the roof of the mouth is covered to create that suction cup. The negative with the covering the roof of the mouth is the fact that that does cut down on taste significantly. And that's very important to understand that before you make a decision on your treatment. Because with an implant stabilized full denture up top, that can be removed. The roof of the mouth area can be removed, and that does help with taste a lot. The only way we can remove this is by adding the implants. We need something else to help hold this denture in place besides suction. So implants are placed in. The implants are titanium. They're very biocompatible, and the denture has O-rings in it that fit over the tops of those dentures, or over the tops of the implants, and it snaps into place. That's what holds this denture in. So again, the roof of the mouth area can be cut out. This is totally removable. The patient can take this in and out at any time, which helps with cleaning. A lower full denture with stabilization, with implants, I think is a minimum that patients should consider when they're edentulous without teeth in the lower arch. Chewing is cut down by 90% or more when you have a traditional lower denture that does not have something helping to hold it in place. So I consider this minimum treatment for someone who has no lower teeth. I think there needs to be something to help hold that denture in place. Otherwise, it literally is flopping around, and trying to chew with something that's moving all over the place is very, very difficult. It can be done in a single day. Implants are added to the ridge that are made of titanium that are very biocompatible. There are O-rings in that lower denture that hook over the top of those implants. And when this is placed in, it snaps to place, and that gives it retention so that you can chew and it's not flopping around in the mouth. After reviewing removable options for tooth replacement, I'd like to go over with you fixed options. Fixed means it stays in place. You cannot take it in and out. If you're missing just a few teeth, one option is what we call a fixed bridge. A fixed bridge is where we have adjacent teeth to a space. So on this patient, they're missing their two front teeth. We place crowns over adjacent teeth to the space, and this is all one piece. There's two solid teeth in the center with crowns on each side, and this is glued into place over those teeth. The teeth that are being replaced just touch up against the tissue snugly. They're not going up into the tissue. They're just touching against it snugly. Again, this is glued in. I cannot take it out. Patients cannot take this out. You clean this in the mouth, and it is not removable. The nice thing, the big plus about a fixed bridge is that it does not take up any extra space in the mouth that's not normally taken up by the teeth. It can be a little easier to decide on doing a fixed bridge. Let's say the adjacent teeth to the space require crowns on them, that those teeth are breaking down somewhat, they're fractured, they have a lot of cavity in them and need crowns anyway. If the two adjacent teeth to a tooth that's missing need those crowns, it's very easy to fabricate a bridge that replaces the tooth that's missing and also provides those two crowns. It's all one piece there, again, glued to place, achieving the crowns along with tooth replacement. This is a full arch situation where a patient is edentulous. They have no teeth remaining in that arch, and it is possible, this is the closest thing if you have no teeth to having your teeth back. This is multiple implants with what we call a roundhouse restoration that is glued into the mouth. Once it's glued in, again, it stays in place. It is not removable by myself or the patient, and it just stays in place. Again, aesthetically, we can do pretty much whatever we want. Change color, shape of teeth, position of teeth, and we can customize it. So if you are a patient that are missing teeth, multiple teeth, single teeth, full arches, we certainly can determine the best route for you to go for tooth replacement for your budget. So I would be happy to help you, be very interested in helping you in reviewing all of your options and determining what's best for you.